Hi, yes, we are live. Okay, good. Hi, everyone. Hi, guys. Hi. I'm doing a live in my dental clinic. All right. Hi, guys. Woo. Okay, good. It's 1 p.m. For some people. Sebastian. Hi, guys. Hi. Wow, unknown gods. Hi. Yes, get ready. Okay. Yes, we are live already. All right. Pool place. No. Hi. Uh, Rush me. No, you're not late. We just get started only. Just started only. This is maybe just within 1 minute. You're in fact early. Alex, hi. It's midnight for you. It's noon time in Singapore now. It's actually also a lunchtime for me, so I'm having a little bit more time. Okay. Hi guys. Hi. Medi Frigids. Not trying to be rude. Fighting over time. There are different timers. Okay. Guys, hi. Yes, Raman, remember to brush 2 times a day, okay, and floss every night. Yes. Hi, Siu Fan. Hello, hi guys, hi. Let me know where you're watching this from, okay? I'm actually here live in Singapore, of course. Let me know where you're watching from. Hi, Nicholas, okay, from Singapore. Hi, Maddie. Hi. Okay. I know it's night time in the other part of the world. All right. Okay. Ron Stewart. Okay. Hi. Simon, the train guy. Hello. Hi. Very good. Sebastian. Yes, very good. Okay. Now it's lunchtime. Doing intermittent fasting, so not having lunch. Okay. So I'm drinking water. Do you like my apple water bottle? Hello. Hi, Joseph. Hi, Paula. Shout out to you. Hi. Hi, guys. Hi. How's everyone doing? Okay. Yeah, in the dental clinic, it was busy in the morning. A little bit of stretching. Okay, a little bit of stretching. Okay. Hi guys, hi. Mongolia, don't know how to speak that. I can speak English and Chinese only. Okay, is the lighting from this the white light? Does it look better? Okay, good. I got paid enough. Hi guys, hi. I'm in Sandro's Dental Surgeon, okay, the dental clinic in Tanjong Pagar, Singapore. All right, good. Thanks, everyone. Okay, good. How's my day today? Okay. Uh, um, in the morning, I actually had a patient, a review for a patient to do the removing the stitches. We actually removed the wisdom tooth on the lower back tooth and also the lower back tooth. So we actually removed 2 wisdom tooth on the uh, uh, both sides of the lower jaw, and that was last week. So today what we did is just to remove the wisdom tooth. We also managed to actually do some preventive care by sealing up the groove on the wisdom tooth. Yes, we are live. Okay, yes, we are live. So that's what I did for my earlier patient. Also, we have some patients with fracture, chip tooth. Also, what we did for the patient with chip tooth, it actually chipped yesterday. So when the tooth chip, then what happens? The surface tend to be a little bit rough. Food gets trapped. So what we did actually, what I did just now was just to clean up the area. We put in a filling. We also took the time to actually do a good cleanup. Always good to get a cleanup done when you're at a dentist. Then before you do any treatment, I think that's a good thing to do. All right, okay, and good. And yes. Thanks for the super chat. Okay, Metalhead. Thanks for the super chat. You got a new electric toothbrush? Yes, that's great. Yeah. Good. Thanks for the super chat. And Johan, hi. Yeah. So that's what I did today. Okay. What else did I do? Okay. Cheap and mainly cleaning. Okay. Also did some clean up. Afternoon to have a few more patients coming at from 1. Okay. From 1 be seeing patients again, and 1 p.m. So an hour from now. Okay, an hour from now be seeing patients again, and there'll be also a wisdom tooth surgery. I do a lot more wisdom tooth surgery. That's something I enjoy. Okay, in fact, I do a lot less things nowadays. I do more cleaning, fillings. Okay, wisdom tooth surgery. Um, yeah, very limited scope now, and spend a lot more time doing YouTube also and TikToks. All right, hi guys, hi. How does Disclosing tablet taste like? Okay, it tastes actually pretty sweet. Smells like banana or something. Yeah, yeah, good. Yeah, Q&A starts. You can put your questions, and I'll try to look at the questions and try to answer. Because it's moving very fast. I, uh, okay, is being a dentist fun? Okay, I guess so. I don't know, I've been doing this for years already. I guess I'm enjoying myself. There's also time that it can be quite stressful, and I guess that's everything in life also. Alright, does a banana peel actually clean your teeth? Go and get a toothbrush lah. That shouldn't be even be the answer, a question. But yeah, there are people talking about banana peel. Even using a finger to brush, best is of course use a toothbrush. Okay. Mutu was asking which is the worst patient that you got. I don't say it's the worst patient. Sometimes it's just chemistry. Sometimes if the chemistry is not right, okay, then it might be a good idea to see another dentist so that we can make better chemistry and better for the patients. It's just, yeah. And maybe the worst ones is the patient that don't turn out. They book appointment and don't turn out and don't answer the phone call. Alright, good. Let me show you the dental chair. This is the dental chair over here, okay, in my dental clinic. Best thing to whiten teeth, okay. The best way to whiten teeth. Ooh, this is moving. Let me see. Okay, the best way to whiten teeth. You can either go to the dentist and do chairside teeth whitening, or you can do customized whitening tray. I think these are the two ways you can whiten your teeth. Filling's important. If there is a fracture on the tooth, there's still decay, better to get the decay sorted out early than to get the filling done. The filling cover up the area so they don't allow the decay to progress into the nerve of the tooth. When it goes to the nerve, then you might need things like root canal treatment and crown, more complex treatment. Alright. Okay, since I'm actually on how many patients do you have daily? It really depends, okay? Really depends. So sometimes it can be a busy day, can be maybe like 10. Sometimes it can be like 4 or 5 if the procedure are complex, like wisdom tooth surgery. There are times that I can have maybe like 4 wisdom tooth surgery, or 2 in the morning, 2 in the afternoon. Okay. Can you tell me good toothbrush? Any toothbrush is good. Soft toothbrush is actually fine. Toothbrush, toothpaste, for toothpaste, always good to choose a toothpaste with 1000 parts per million of fluoride. The fluoride content inside the toothpaste will help to prevent tooth decay. Yeah. So I'm in the dental clinic. What? Basil leaf cure toothache. There are, I mean, on the internet you do see a lot of different things that many people use to solve dental problem. So far, Basil's, I don't think Basil's leaf there's no scientific proof yet, so I don't think so. How long will this stream last? I have no idea. Okay, I have no idea. Let's see how it progress. Okay, of course I'll be here for a while. Okay, or maybe if I'm hungry, I will end this stream early. But otherwise, the latest will be should be at 1 p.m. Yeah, but I'm not talking too loud because I think sometimes my colleagues around the area they are seeing patients so I might not want to make it too loud. English, hi. Thanks, Smiley. Okay, good. Country, Singapore. Language, English, Chinese, and that I speak. Shout out to Dada J. Is it? Oh, good. Okay. Oh yeah. That's a very good question. Okay. Nicholas, is it Nicholas Tan is asking, is it better to brush before or after breakfast? Okay. Honestly, it doesn't really matter. Okay. And for me personally, I have a habit of brushing in the morning. That's since young, since my mom actually got me to brush in the morning before my breakfast, so it becomes a habit. So I do brush before breakfast, and that's what I do. Okay. But after breakfast, I also do have a good rinse. That's also a habit. I like to rinse away the food trap or so. But if you like to brush after breakfast, it's good also. After meals is good also. But do take note that if you are taking any acidic food and drinks like Coke, lime juice, anything that's acidic, don't brush immediately, because the acidic food and drinks can soften the enamel of the tooth. Then when you brush, it can cause wear also. So go with a soft brush and don't brush immediately. Okay. Thanks for the super check, Sabah 1509. Thanks for the super check. And your question is, you need to have a tooth extracted next week, and you're so scared. Do you know any tips to make the whole experience less scary for you? Okay, okay. To make the whole experience more comfortable for you, okay. Sabah 1509. These are the things you can do. Okay. Number one, okay. Of course, good to bring family members along, okay, family members along or friends along to accompany you for the procedure. That's number one. You can also wear earpiece, okay. Listen to your favorite music, okay. Let your dentist know, okay. I'm sure they're fine. Just not too loud, okay. Not too loud so that you can still hear your dentist talking to you, okay. And of course, establish some things with your dentist, like with my patients, I always tell them that if any point I'm not comfortable, always raise your hand. Okay, you raise your hand, they will look out for you. But not to worry also, if it's extractions, I'm sure a dentist can do a good job. Usually they numb the area. Once you numb the area, 100% be numb, you won't feel anything. But of course, if you do feel any, just let them know, okay. Must let them know, okay. It has to be 100% numb. 1% not comfortable, let them know. They can numb further to make everything more comfortable. All right, okay. Super Goten. Okay. Hey, can you make custom toothbrush? I guess so. We can all make custom toothbrush like what everyone can do, but I'm not interested at this point in time. Not interested, really not interested. Maybe when I'm interested, you see me doing. Yeah, you can see my I mean when I'm inspired, or maybe I have a sudden want to do certain things, and you see me doing that, but not now. Maybe. What toothbrush do I use? Any soft toothbrush? I use a lot of toothbrush now. I use the 50-cent toothbrush that I did on my YouTube and TikToks. I've been using Systema from Lion. Okay, so any of the soft toothbrush. The hard ones, I use it to scrape I pass it to my helper. We use it to clean the basin, all these things, the hard brush. So don't use the hard brush. Always go with a soft toothbrush. Okay, everyone? Hi, friends from Florida. Hi. I love Disneyland. I haven't been to Disneyland, Florida, but we went to Hong Kong and Shanghai. I love Disneyland. One of the best places to be. But now with COVID, we all can't travel much. Okay, best work experience you have had. And from Florida, it's 12 a.m. here. Oh, yes. All right, good. Okay, good. Best work experience I had, I guess doing my wisdom tooth surgery well. Okay, my first few patients, my first few surgery was really not ideal. But with time, after doing many cases now, I'm doing a lot more better. So I do enjoy doing wisdom tooth surgery. The feeling of getting a impacted wisdom tooth out, making sure and looking after the patient well, so that they have minimum discomfort. Okay, I think that's something that I find a lot of joy. So yes, I do enjoy wisdom tooth surgery a lot. Okay, Static Star. Hi. You have a question? I have a really bad pain in my teeth, so have a big cavity. Is there anything you can help me out? Okay, so aesthetic star, what you can do if you have very bad pain on the back teeth and things are giving you discomfort, what you can do, brush well, floss well, of course chew more on the other side. Definitely a good idea to get your dentist to have a look. Okay, if it's a small decay, they can actually remove the decay, put in a filling to cover it. But if it's a big issue, then better to get a filling done early rather than later. A deep decay can actually results in root canal treatment, okay, where the nerve of the tooth is not ideal. You need to take away the nerve, then put in a root filling. So good to get it done earlier than later. Nicholas Tan, what am I eating for lunch? Okay, it's noontime in Singapore. It's lunchtime. I'm doing intermittent fasting, okay, and so my last meal was actually dinner yesterday. So no breakfast in the morning, no lunch, at least for now. So water, I'm going to drink lots of water, and this is my busy morning today. So I finished 1 liter. This is my 2nd liter, so I haven't finished 2 liter water. But right, usually before lunch I'll do 2 liter. Then after lunch we do another 2 more liter. That's my water routine. So the next meal should be dinner. Oh yeah. What was the question? I see some question. Oh yeah. Should we actually use toothpaste? Fluoride toothpaste, of course. Fluoride actually helps to prevent tooth decay. Correct. We would like not to have tooth decay. Okay. Yes. Why are you named doctor when you are a dentist? Well, as a dentist, we are also known as a doctor. So my patients will call me Dr. Pei or Dr. Tristan. Yeah. Yeah, correct. So I guess doctor is just a long term. Yeah, that's how a dentist is also a doctor in Singapore. I mean, different countries got different different styles. Okay. You have a flossing cavity before. Oh my. Okay. A flossing cavity usually means it's in between the teeth. Okay, if in between the teeth, okay, food gets stuck in between the teeth, then decay can happen. Okay, a flossing cavity could be a food trapping or things get stuck in the spaces. So that's why it's important to floss in between. Brushing can only clean the front surface, biting surface, and the inside surface. So we can't clean in between, so flossing is important. And the best way to brush, of course, if you look at this, the best way to brush using the modified buzz technique, the simplest way to brush is just up and down. But if you could actually brush, you can actually use this modified buzz technique. You point the toothbrush 45 degrees to the gum, you squeeze the bristles into the gum pocket, jiggle gently, that will help to clean up the area. Then after that, brush upwards. One more time again, okay, jiggle gently into the gum pocket, okay, then brush upwards. This is called a modified buzz technique. It's actually the best way to clean. That's what we learn in dental school. But to do it every day, good idea. Especially if the area is hurting you, if the gums are bleeding or sore, then better do it. All right. How much toothpaste should you use? Vaza was asking how much toothpaste should be used. Okay, if you're using for children less than 3 years old, okay, when they can't speak. Pardon me. I keep the tripod. When children less than 3 years old, when they can't spit, then good to use a smear layer amount of toothpaste. A smear layer is just like a rice grain amount, or a rice grain, or just a smear layer amount of toothpaste. Correct. And yeah, maybe I should get a toothpaste here. Then I can show you all better. Just a second. Okay, I'm back. All right, best mouthwash. Okay. Yeah. Example of a toothpaste to use would be a toothpaste with at least 1,000 parts per million of fluoride. Yes, this is a kid's toothpaste, but because of 1,000 parts per million, I would say it's actually a good toothpaste. Okay, so yeah, so for kids less than 3 years old, Okay, this is the amount of toothpaste to use. We use a smear or rice grain amount of toothpaste. This is actually enough for children, for a kid less than 3, for a child less than 3 years old. Okay, and for children above 3 but less than 8 years old, it's always a good idea to use a pea-sized amount of toothpaste. Okay, why pea-size? Because excess fluoride that is swallowed and the teeth are still forming will form white lines or spots on the teeth, also known as dental fluorosis. So we use a pea-sized amount, but most important is to don't swallow the toothpaste. Don't swallow the toothpaste. And if 3 years old, and if the child is 3 years old and can't spit out the toothpaste, then don't use pea-size yet. Okay, when the child can spit up, then use pea-sized amount of toothpaste. And don't swallow the toothpaste. Okay, anything older, if you're older than that, maybe after age 10 and above, it really doesn't matter so much. It doesn't really matter so much if you use a fat gulp or you use pea-sized amount. Why? Because the teeth, the enamel of the teeth has already formed, so the white spots or will not be so much. And also, adults usually don't swallow toothpaste, or older children usually don't swallow toothpaste. Okay, good. I hope that helps. Okay, and good. Let's see what's the question here. Thank you, Aesthetic Star. Yeah, glad to share. Hi, fluoride. How much mouthwash should you use? Okay, I don't really. I'm not a fan of mouthwash every day. To me, brushing twice a day, flossing every night is actually good enough. Okay, some people like to use mouthwash because of the minty taste, the freshness in the breath. If that's the reason, sure, go ahead, because everyone has their own preference and choice. I think that's fine. Okay, Carrie, thanks for the love. Love you back. And best electronic toothbrush. Okay, Amazon. Okay, what you can do is that best way to find. I would say Sonic. There's one Sonic brush that I use. There's also not too expensive, but it's actually pretty good. They come in 8 tubes, 8 toothbrush bristles. I actually got it. Actually, I did a video on the Sonic brush. It comes with 8 toothbrush heads. 8 toothbrush heads. So actually, I find it quite good. The Sonic vibration. Actually, there's a lot of good Sonic toothbrush out there anyway. Okay. Does toothbrush size matters? Okay. Some people like a smaller head. Because they feel that they can reach the back area better. I prefer a bigger head. Okay, so we can reach all the teeth and clean faster and more efficient. But if you're using a big head, always close your mouth halfway. Okay, don't open your mouth wide, because when you open your mouth wide, when you want to clean the side, the cheek will push against your toothbrush, so you can't reach further back. Maybe you'll be here. But when you close your mouth halfway, then you can stretch the cheek, then you can reach the back area here a little bit more better. So by closing mouth halfway, maybe the technique is more important. All right, good. I'm a dentist. Okay, I'm a real dentist. I've been doing dentistry for 17 years. Yeah. Okay, good. How do I floss with a floss stick? Okay, the thing about a floss stick is that what is a floss stick? A floss stick is a stick with a floss like that. Okay, it's actually very useful for people who find it's very useful, but I honestly I don't feel that it's actually a good idea to use a floss stick. Why? Because it's very convenient to go in and out. But the way to floss is not in and out, but it's to hug and scrub. Also with the floss stick, I find it very difficult. And using a floss stick, you only have this thread. And once something tear, you still have to you still be using the floss stick. So not so convenient. Yeah. Okay. Piliang 231. Can you do a shout out for you? Yes, I think that's a shout out already. Thanks for liking my channel, everyone. Okay. Chinese gang. Where do you find Disclosing tablet? I bought mine from Amazon. Okay, everyone, you can get it from Amazon. Yeah, very good question. Muhammad Malik. Okay, very good question. Can you whiten your teeth by just simply brushing regularly if you have yellow teeth? My teeth is also naturally yellow. Yellow is a natural color of teeth due to the second layer called dentin. Okay, so to answer your question, can you whiten your teeth? Okay, first of all, there are two types of stains on the teeth. The first type is actually called outer stains, or it's called outer stains. The other one is called inner stains. Outer stains we can brush using a toothbrush with toothpaste with abrasive. Any toothpaste can help. By cleaning away all the surface stains on the teeth, your teeth will look brighter, shinier. Without stains on the teeth, the tooth of course will look whiter. It's the same thing as when you go and wash your car or wash something. When you clean it well, it will be nice and shiny. So this is the outside surface that you can clean. So brushing well, okay, helps to clean away the stains, and that will make it nicer. And of course, you can also see your dentist for professional cleaning, and they can shine your teeth, make it nice, bright and shiny. Okay, and the second thing, of course, if after doing cleaning with your dentist is not good enough, you can see your dentist for professional teeth whitening, either customized whitening tray, or you can do chairside teeth whitening. These are the two ways. Okay. Channel idea for who? Let's see, someone talk about Dental Digest. Okay. Have you got your channel idea from Dental Digest? I learned a lot from Dental Digest. I should learn a lot from a lot of people. Actually, I love to learn things. Yeah, I love to learn things and keep learning things from many wonderful creators. And learn from many people. Okay, but the one that most people on my YouTube channel pick up on is actually of me learning from Dental Digest. But I learned a lot from everyone. Okay, so keep learning, everyone. Don't bother about the judgment of other people. When people say they will copy, who don't copy? I copy how to walk from my parents. I learn how to do fillings from my professors. I learned how to do wisdom tooth surgery from my dentist, from my supervisors, and I copy a lot of things from everyone. So why be so particular? Just don't bother about opinions of other people, and keep learning, keep getting better. This is just for everyone. Keep getting better, keep doing well, do good. Don't bother so much about how other people feel. All right, water flossing or normal flossing, which is better? Okay, I have done a video on on the water floss. Personally, I love water floss because it's convenient, and it's quite fun. Okay, but I've done the disclosing time video on water flosser, and it doesn't clean the spaces so well. So yes, you can use a water flosser, but it's still a good idea to floss using a normal floss. Monica, you and your mom loves my video. Thank you, and thanks for subscribing. Yes, everyone who's here, 97 of you here, do subscribe to my channel. Okay, and follow me to learn more dental tips. Turn on notification so they can see more videos, or to see this live when it live. Is it necessary to brush your teeth 2 times or 3 times a day? Okay, from personally, I prefer 2 times a day, morning and night, or maybe that's what I do. For myself, I brush 2 times a day, okay, and floss every night. Whereas from American Dental Association, they do suggest 3 times a day, okay. Yeah, there's no right and no wrong. Okay, just choose something that you are comfortable with. Mouthwash usually only indicate mouthwash when there is gum infection or when the gums are not ideal. Personally, brushing and flossing is a chemical way. Brushing and flossing is a mechanical way of cleaning. Mouthwash is a chemical way. So good brushing and flossing is actually good enough. Mouthwash is really optional. It's actually known as an adjunct to cleaning. That's what I learned in dental school. That's what I learned in dental school, as an adjunct to cleaning. So don't really need to, but it really depends on you. If you like the taste of a mouthwash, sure. All right, good. Okay, good. Thank you. Thanks, guys. I'm scared when I got no teeth. Don't be scared. Alright, good, guys. What's my favorite movie? I love Disney. I love all the Disney movies. Frozen 2, Frozen. I like anime also. Watch a lot of anime, a lot of manga. One Punch Man. Been watching a lot of One Punch Man. Tears of Demon God, playing Mobile Legend. Now not watching so much. Very scared to watch Netflix. Because once you start watching a series, you can't stop. Sword Art Online. Do you guys watch all this? Do you guys watch all this? You are not late. Hi. Yeah, 30 minutes. So okay. Yeah, more subs please. Yeah. Subscribe. Yeah. Okay. Alright. At what age should we start flossing? Okay. I started flossing when I was in dental school, year 2. So the best time to start flossing is, so year 2 was actually maybe 22 years old. Okay. The best time to start flossing, okay, or maybe the best time to start brushing. The best time to start brushing is as early as you can. Same thing for flossing, as early as you can. Don't be like me. I only, when I was in dental school year 2, then I start flossing. Alright, good. So, yes, Princess Avery. Hi, shout out to you. Alright, yes, I watched One Piece. They are fighting, what's the Beast Pirate now? Okay, he will definitely win. One Piece. I love the whole series, One Piece. Really amazing. Okay, the friendship, the trust, okay, and the belief. Okay, so actually you can learn a lot of things. I copy a lot of things from One Piece. No lah. So many things you can learn. So motivational. Okay, toothpaste with baking soda. Okay, I don't suggest using baking soda. Yeah, just if you want to have whitening toothpaste, then look for toothpaste with hydrogen peroxide or carbon peroxide. These are the 2 ingredients that's important for teeth whitening. So if the toothpaste don't have these 2, then it's a normal abrasive toothpaste to help to clean away surface stain. But to have whitening effect, then you need to have either this thing, carbamide peroxide or hydrogen peroxide. Wow, Cosmo 777. Thanks for the super chat. Okay, thank you very much. Okay, good. Happy to be an inspiration. Like I'm also inspired by many people, especially I must give a lot of credit to Dental Digest. Okay, after I do my polling, actually a lot of people came in because they love my duets with Dental Digest. Yeah, more than me brushing my own teeth, I think. Yeah, I mean, Dental Digest is excellent. I mean, I will never be better. Maybe we'll be better. I don't know. Who knows, really? Just do something I enjoy. Who cares about who is better, who is not better, really? I'm 42 this year. Do I need to be who? I'm not bothered, really. I'm just out here having fun and trying to share good dental knowledge with everyone. If I can get every one of you all to brush better 2 times a day and floss every night, if you can have less chance of having decay, less dental issues, best not to have any decay, I mean, I'm happy. I'll be very happy really. Yeah. So who cares really? Yeah. So sometimes also try not to be too bothered. Learning not to be too bothered of views and subscribers. I think that's also very important. Okay. Just produce content and just have fun. And thanks everyone for watching my videos. I still appreciate you all for subscribing my channel and so thank you. Toothpaste for sensitive teeth, Sensodyne, Colgate Sensitive. These are the common brands in Singapore, but of course you can go and find there are so many. Just choose a brand that you are comfortable. Thanks for subscribing. Okay, on a scale of 1 to 10, how confident are you that you'll reach 1 million by the end of 2021? It doesn't matter. I would love to have it, but it's not the most important. Okay, trying at times not to be too focused on the numbers, rather than focus on numbers, focusing on getting the content out for everyone. Okay, and maybe having fun. Sometimes when you're too focused on numbers, you lose track of a lot of things. Okay, life also, when you're too focused on money, you lose track of a lot of other things also. Yeah, just focus on being yourself. And can I get an opinion on Australia? I love everyone from everywhere. Yeah, so yeah, good. Everyone is. I'm a very simple person, or maybe I'm not so interested in politics, because I'm not a politician, and it doesn't really matter. I'm not a politician. I'm also not a religious leader, and yeah, all is good. All is good. This is an old toothbrush. Old toothbrush. What is it? This glasses is actually getting a little bit old. I should be getting a new one. I done a YouTube video, duetting someone doing this. Don't know what I'm doing it now. So. Do you have any other jobs? Okay. I'm a full-time dentist, and when during lunchtime, like right now, and I'm free during my 1 hour lunch when I'm not eating. Maybe because I'm not eating, I have a lot more energy. The sugar is not going from to the blood is not flowing to the stomach, so there's not small alert. I'm drinking my water. I still didn't finish my water. Best toothbrush, any soft toothbrush? What's the question just now? Talking some halfway. Oh, my other habits or hobbies. Okay, I always have an interest in learning things. So after dental school, actually I venture and do a lot of things. I went to a lot of investment course, property course, stock course, option course, forex course. I did a lot of things. I done forex trading, Bitcoin, cryptocurrency. When I was in cryptocurrency, I was in revenue sharing, traffic monsoon. I did a lot of funny things. Or maybe I'm very interested and keen in learning all these things. Yeah, cryptocurrency. Now not so much. Now I'm not in. Yeah. Because when I'm into the market, it's getting too involved. Now I'm just on YouTube, TikTok, sharing that knowledge, doing my dentistry. Okay, that's where I am. I actually have a license in real estate also. Back in 2011, 2010, 2011, I actually went to take out a course on real estate. So I have a real estate license. Yeah, I sold a few properties before also. But that's a secret, don't tell anyone. Okay, don't want to confuse anyone. But now I don't, I just maintain my license for real estate properties. Okay, yes. Let's go back to the question. What sport do you like to watch? I don't really play much sports though. Very sedentary. Okay. Watch. I used to play basketball and table tennis. Let's answer some question. This whole video is supposed to be Q&A. Now, Nicholas asking, best toothbrush, soft toothbrush. Okay, don't spam already, Nicholas. Otherwise, you'll be banned. Alright, good. Okay, Evelyn, few question. Question 1. What of you sometimes brush your teeth one time? What is number 1? Okay, Evelyn asking, what will happen if you brush your teeth one time? Go to brush 2 times a day. Okay, don't brush once. Brush once, sometimes you don't clean well enough, then the plaque can harden to form stones. Stones attract more plaque, cause gum redness, and not good for the teeth. Okay, what's working like as a dentist? Basically, we are always in the clinic. Okay, yeah, I thought that I will always be in a clinic, trapped on the dental chair, but wait, I'm wrong. Now, I'm actually here doing a global presentation with everyone here. So it's awesome to be a dentist. Okay, it used to be a one-to-one interaction with my patients only. Now it's a 1 to 96 of y'all. Thanks everyone for being here, all right, and watching me live and sharing my dental knowledge. So yes, when I'm with my patients, I will focus and treat them very well, 1:1, okay? But when I'm not with my patients, now I'm here, I will treat every one of y'all, 96 of y'all here very well, as much as I can. And okay, working like as a dentist, yeah. How was your day? My day is good, busy morning, okay. Going to be busy in the afternoon, yeah. Okay, happy to reply you. All right. Wow, so many messages. Thanks, guys. Okay, I would love to answer. SpongeBob toothbrush. Don't have that. Maybe you can go and find. Favorite color? Blue? Red? Pink? Blue more? Black? White? Yeah, don't have a fixed color. How to brush your teeth? Can tell me how you show us how to brush. Do you want me to show you how to brush teeth? I thought I've done a few videos on that. Let me just clean away this. All right. Okay. Brush. Okay. To brush your teeth. Okay. We always go 4 rounds. Okay. To clean, we clean 4 rounds. Brushing is 3 rounds. Okay. The last round is flossing. Okay. So how to clean your teeth every day or twice? To clean 2 times a day. The first is actually to clean the outside surface. So when you open your mouth jaw wide, you can't really reach in because the cheek will be very tight. So by closing your mouth halfway, okay, you can actually stretch your cheek, then you can clean the back area better. Okay, always start from one end, then you go to the other end. Okay, there are 2 ways to brush. Okay, the method, you can either brush up and down. Okay, the best way to clean is actually the modified buzz technique, where you push the bristles of the toothbrush 45 degrees into the space, you gently jiggle, and then brush upwards. This is jiggle gently and brush upwards. It's different from sawing. This action, sawing, will wear away the enamel and will cause gum recession. Don't do that. Don't do that. Don't do that. Don't saw your teeth. Okay? Then just seesaw into this 45 degree modified buzz technique. Seesaw into the brush upwards. Seesaw into the area, brush upwards. Okay, so the main thing is to clean 1 round. By going 1 round on the outside surface, you don't miss anything. Don't start from the front. You start from the front, you might stop here. So always start from the back. By closing your mouth halfway, I can stretch my toothbrush to clean the back area better. Okay, then after that, the top. Okay, the second round, we clean the inside surface. Always starts from one end of the tooth. Okay, to go to the other end, then one end of the tooth to the other end. That's the second round. The third round, of course, we're looking at is to clean the inside surface. Okay, this area here, sometimes a little bit tougher. If you can squeeze the bristle, jiggle upwards. If you can, squeeze the bristles into the area here, jiggle upwards. This is what you can do. Okay, and of course, after that, the top area here, you can brush. Okay, so this is the 3 rounds. The 4th round, of course, what we're looking at here is to floss, using a dental floss to clean in between the teeth. That's the 4th round. Okay? Doesn't matter lah. Brushing before or after meals is perfectly fine. I love all of you, okay? I love all of you here, okay? It doesn't matter which religion, where you're from, okay? India, US, yeah. But don't spam. Alright, I see that. Michael, okay? Yes. Sure. Alright. Brushing before or after meal doesn't matter. Personally, I prefer to brush before meals. I go, don't worry. Just. All right. Shout out to BroBoy2566. Done. Daniel Lee. Thank you. I'm nice because everyone here is also nice to me and looking out for me. Thank you very much, everyone. It's brushing time. I brush twice a day, morning and night. Okay, yes. Pakistan. Hi. Do you like the toothbrush from Pakistan? Mouthwash Club. I got the Mouthwash Club toothbrush from that's manufactured in Pakistan. Yeah. My first time using a toothbrush like that. Very different. Oh my, there's someone in your house. Oh, what is calculus? Okay, very good question. Dental plaque is soft on the teeth. Over time, they will build up on the teeth. They are made of bacteria and some food debris. Over time, this plaque can harden. They form stones, also known as tatas. So when tatas are formed, brushing doesn't clean them away. So you have to see your dentist to get them cleaned up by dental scaling. Okay, good. Guys, okay, really got to go already. Okay, thanks everyone for being here. Alright, I'm going to finish my water and maybe check out the washroom before seeing my patients. Thanks everyone. Okay, and stay well, stay safe. I know it's sudden, okay, but really got to go. Okay, I'll see you then. Goodbye, everyone. Thank you.